Hello, everyone. Welcome to the Health Series podcast. Today we are looking at the topic, the healthcare system of Nigeria versus United States. Healthcare systems in Nigeria and the United States differ significantly in terms of structure, funding, quality, and access. In this episode, one will compare the healthcare system of the two countries under 7 major areas. 1. Structure and organization. Nigeria has a 3-tiered healthcare system divided into primary, secondary, and tertiary care. Primary healthcare is meant to be accessible at the local level, with secondary and tertiary facilities handling more complex cases. However, healthcare provision often falls short due to limited infrastructure and resources, and a significant percentage of the population relies on traditional or alternative medicine. Whereas, the U.S. healthcare system is primarily privatized, though it includes government-run programs like Medicare, for seniors, Medicaid, for low-income individuals, and the Veterans Health Administration. The system is complex, fragmented, and heavily dependent on insurance providers, resulting in variable access to healthcare services based on a person's insurance status. 2. Funding and cost. Nigeria. Healthcare spending in Nigeria is low, both in per capita terms and as a percentage of GDP, with many citizens paying out of pocket for services. Public healthcare funding comes largely from the federal and state governments, but financial constraints limit the quality and accessibility of care. The National Health Insurance Scheme (NHIS) was established to improve coverage, yet only a small percentage of the population is enrolled due to operational challenges and inadequate infrastructure. Whereas, the U.S. spends more per capita on healthcare than any other country, yet it lacks universal healthcare coverage. Costs are high due to factors like administrative expenses, the high cost of pharmaceuticals, and advanced medical technologies. Many citizens rely on employer-sponsored health insurance or by private insurance, though millions remain uninsured or underinsured. 3. Access to care. Nigeria. Access to healthcare varies widely based on geography, socioeconomic status, and urban versus rural residency. Rural areas suffer from a shortage of healthcare facilities and professionals. Even in urban areas, overcrowding and limited resources affect quality. Although the NHIS aims to provide broader access, it has not reached the vast majority of Nigerians. Whereas, United States, access is primarily dependent on insurance status and income. While those with insurance can access a wide range of services, millions without coverage face barriers, particularly in preventive and primary care. Additionally, rural areas in the U.S. also experience shortages of healthcare professionals, impacting access to care. 4. Quality of care. Nigeria. The quality of care varies widely due to inadequate funding, outdated facilities, and a shortage of healthcare professionals. Access to advanced care is often limited, and diagnostic equipment and supplies can be lacking in public hospitals. Some affluent Nigerians seek medical treatment abroad, often referred to as medical tourism. Whereas, United States. The U.S. has some of the best medical facilities and specialists in the world, but the quality of care can be inconsistent and often depends on insurance coverage. While high-tech interventions and specialized care are widely available, primary care and preventive services may be less accessible, especially for uninsured or lower-income individuals. 5. Health outcomes. Nigeria struggles with high maternal and infant mortality rates, infectious diseases, such as malaria, tuberculosis, and HIV/AIDS, and a growing burden of non-communicable diseases, NCDs, like hypertension and diabetes. Life expectancy is lower than in high-income countries due to these factors. Whereas, United States, despite high healthcare spending, the U.S. also faces challenges, including high rates of obesity, heart disease, and diabetes. Health outcomes are influenced by socioeconomic disparities and a lack of access to preventive care for certain populations, leading to lower life expectancy compared to other developed countries. 6. Healthcare workforce. Nigeria has a shortage of healthcare professionals, with a high migration rate among doctors and nurses moving to other countries in search of better pay and working conditions. This brain drain severely affects the healthcare system's capacity to provide quality care. Whereas, United States. The U.S. has a larger healthcare workforce but faces shortages, especially in rural areas and in primary care. Additionally, the high levels of burnout and turnover among healthcare workers, exacerbated by the COVID-19 pandemic, remain challenges for the U.S. system. 7. Technological advancements and innovation. Nigeria, while limited in resources, Nigeria has seen growth in telemedicine and mobile health technologies, driven by the need to improve rural access. However, infrastructure limitations, such as unreliable internet and power, can limit the adoption of technology in healthcare. Whereas, United States, the US is a global leader in medical research and technology. Innovations include electronic health records, EHRs, telemedicine, AI in diagnostics, and advanced treatments. However, high costs of these technologies often mean that their benefits are more accessible to those with comprehensive insurance or financial resources. These differences highlight the challenges and strengths of each system, especially when considering reforms to improve quality, accessibility, and sustainability in healthcare. We'd appreciate it if you'd like the video and subscribe to the channel.